tonight. Cloudy tomorrow, coastal showers west to southwesterlies around 15 to 19 degrees. And as that low shifts east, it whips up large and powerful surf tomorrow. By Friday, cloudy, showers mainly about the lower Hunter, 13 to 18. And another cloudy day on Saturday. Showers continuing mainly along the coastal fringe around 14 to 19 degrees. So mainly it's the gusty winds that will be under this today.
And there is a severe wind warning, isn't there? But not for our region. It's just going to be really windy.
That's right, yeah.
And that's mainly for the upper peaks and the coastal areas?
It's pretty much for all the eastern parts, and northern tablelands included as well. I'm not sure if it misses this region or not, but I know it's a very wide area. It stretches up around the Hunter Mid-North Coast region, so around the central areas as well.
Yeah, good on you, Vanessa. Have a great one.
Thank you.
Thanks. Vanessa O'Hanlon there from News 24. And traffic, if you're heading out on the roads this morning, all fairly clear on local roads with the school holidays are usually fairly quiet. If you're on your way to Sydney, just a problem at Lakemba with heavy traffic expected due to a special event there. Wangi Road at Punchbowl Road. Helensburgh to Waterfall, the M1 Princess Motorway, the F6, there are roadworks there. And down in the snowfields, there are alpine condition warnings there, which is great news if you're heading to the snow. That's for Kosciuszko Road, the Alpine Way, Snowy Mountains Highway and Guthaga Road.
The count continues.
We will not know the outcome of this election tonight, but there is one thing for sure, the Labor Party is back.
Australia have another hung parliament.
Based on the advice I have, we can have every confidence that we will form a coalition majority government in the next parliament.
We don't have a winner, so what happens next? ABC News Digital, helping you make sense of it all on mobile and online at abc.net.au/news.
And good morning, I'm Caroline Perryman, sitting in for Scott. He's back on Monday at 20 to 7. Now, this hour, a reaction from the Darkinjung CEO, Sean Gordon, to that sentence handed down to the chiropractor from Woy Woy, who was sentenced for abusing Nova Peris online. Sean Gordon is a friend of Nova, and we'll find out his thoughts about that. And Sean Gordon will also be able to talk about what's happening today for NAIDOC Week. There's a special event later on this morning. And sleep. Do you get enough of it? Many of us don't. And we have a sleep expert in the studio right now to give us some tips. That's coming up on the show in just a moment on 92.5 ABC Central Coast.
From Budgie to Bensville and from Wyong to Woy Woy, this is 92.5 ABC Central Coast.
And how are your sleep patterns? Are you getting enough Zeds, or do you find yourself staring at the ceiling for hours, trying to get to sleep only to spend the night tossing and turning and waking up not feeling very refreshed at all? Well, during this Sleep Awareness Week, we thought it'd be a good idea to revisit the topic and to find out what the latest options are if bedtime is a nightmare for you.
The following segment is general in nature and shouldn't be taken as personal professional advice. Listeners should seek their own independent assessment from a qualified advisor and not rely solely on the general nature of information in this program.
And joining me in the studio, I have Dr. Mark Levi. No relation to Scott, is that right, Mark?
No relation to Scott.
And Dr. Levi is from a very large medical practice at West Gosford. And also in the studio is the producer this morning, Yanni Johns, who many of our listeners know from our Smart Arts program. Yanni's back from WA, and we were talking about sleep issues. Before I go to Yanni to find out about your problems, Dr. Levi, how did you get, what was your interest in sleep to lead to your research? You have your own experience, don't you?
Caroline, I'm a terrible, terrible sleep apnea patient for 20 years. So 20 years ago, I was snoring like a train. Wife said either fix it or get out. I don't know if anybody relates to that.
I'm sure they can.
I do. Who's woken up this morning feeling lousy, having been kicked all night by the partner, or woken up feeling unrefreshed? So anyway, my story was that I went to the doctor 20 years ago, 18 years ago, had no idea what was going on, had no symptoms, and look, I'm still a sleep apnea severe patient, a patient, Caroline, but today I'm also a clinician. So I'm also a clinician today. So I see people all day that have problems with sleep. And try and solve problems.
And how many of us are there around Australia or around New South Wales, Central Coast?
Growing at 1 in 3, 1 in 4, growing at 100 miles an hour. Especially with putting on a little bit more weight, there's more and more problems coming up. And look, that's what we do at the clinic. When we're at the clinic, we see people that are either not sleeping well during the night or waking up incredibly refreshed. And we tend to work with a 3-point process that sort of identifies which path or which way to go to sort of look after them.
All right, we'll get to that in just a moment. Yanni, you were telling me earlier that you are on a special sleep machine. What's your problem and how do you solve it?
Well, I have the same issue as Mark, and that's the sleep apnea. And being single for a huge part of my life, up until 2013, then I got married. Once I got married went into the married home, my wife's going, "My God, you snore, and you've got to get this checked out." So we ended up going to one of those chemists in Karratha, and there must be a lot of sleep apnea there because they're very specific to it. Put me on a machine, and I went in the next day thinking, I'll be right, and it turned out I was a severe sleep apnea person. I'd had about 86 episodes during the night where I wasn't breathing.
That's not much oxygen. That's not much oxygen at night, Yanni. Yeah. That's not good for you. That's a train wreck. That's heading towards heart problems. That's heading towards diabetes. It's heading towards stroke.
Yeah. So,
and how does that sleep machine work?
Well, it's like a little pump, and you put a mask on when you go to bed. It's very sexy, and I call it my wife. I call it my passion killer.
But it works. And how do you feel since you've been using that machine?
I feel great, except some nights I have issues with it where it wants to put more air into me than I really need. and I'm fighting with this alien on my face in the middle of the night.
It's pretty alien, Yanni, isn't it?
To pull them off.
It's pretty alien, Yanni, isn't it?
It is very alien.
Hard to travel with.
Yeah, I've got a portable one too.
Right. There must be, Caroline, enormous numbers of your listeners with a CPAP machine out there in the marketplace, and it's very, very troublesome to try and get a gist of it, to work with it, but it's the best in the world. So there's a yin and a yang thing where it's the best treatment in the world, that it pushes oxygen down your lungs. But 5 in 10 people can cope with it.
It's 6:45. You're on 92.5 ABC Central Coast, and Dr. Mark Levi is my guest. No relation to Scott, Dr. Mark Levi, but in the studio talking about sleep. If you have any sleep issues you want to call in about, 1300 925 222, 1300 925 222. Dr. Mark, you were talking about the what causes the sleep disorders, and you said that weight issues we're becoming a heavier nation. What are the other factors that contribute to poor sleep?
Carolyn, poor sleep can come from medication, can come from poor sleep hygiene, which means that people are looking at blue screens and TVs and Facebooks and in bed. We've just put out at the Reliance GP group, we've just put out a new e-book that anybody's welcome to that we can send to them if they want, on sleep hygiene.
Is that for free?
That's for free, and that's about 20 tips on, what temperature's the room, how dark is your room, are your kids or are you looking at TVs and iPhones and iPads in bed, because that affects your melatonin when you're in bed, when you're asleep, and that'll affect your sleep cycles and mess up the whole internals. And this is a silly one, but do you know that if you sleep better, you'll lose weight quicker?
Wow, because your body's working as it should be.
Working as it should be. The hormones, the leptin and the ghrelins are working in balance. And so if you're not sleeping, some people go into it's called a pre-bed ritual to get a better night's sleep. Warm bath, cup of tea, dim the lights. We're all running around really pretty fast, and to hit the bed with all the lights screaming and all the blue lights, terrible. That's a major disaster.
And the police were saying that there have been more incidents of fatalities on our roads, and part of it is due to that we're rushing around. And we don't have time to stop. We're distracted in the car, and it sounds like this is a factor at home that we can't unwind when we do hit the pillow.
We can't unwind when we hit the pillow, and that's where our sleep hygiene Reliance ebook comes in. But here's a point with the driving. We see a lot of people at Reliance in the office, in the clinic, and they're really a danger on the road. They're falling asleep driving the car, Carolyn. So they're sitting at the traffic lights and they're nodding off to sleep. And, you know, if people are commuting from Gosford to Sydney, it's a really, really dangerous thing.
So what are the solutions? I mean, there's medication, I suppose, but that would be surely the last resort. You mentioned a few of those tips about relaxation, about getting the mood right. What are some other major tips you could give people listening that aren't getting a night's sleep? Keeping in mind that they're not shift workers, and that mucks your sleep up as well, doesn't it?
I've got an approach, Carolyn, that goes back to ABC. And I've got an approach that says there's lots of ways to fix a problem, but really, what are we trying to fix? And so I spend a lot of my time with sleep specialists, with cardiologists, with ear, nose and throat people, doctors. Here's my thoughts. Step one is see someone who knows sleep, a medical person who knows sleep, number one. Number two, have a simple sleep test to rule out a lot of the problems. Have a simple home sleep test. We at Reliance do a bulk build one, which is just take it home, and it rules out a lot of issues. It's just A, B, and then the third thing is you go back to you go back to your medical person and say, right, I'm not sleeping. You've had a simple sleep test at home. What do you think it is and what do you think it isn't? And the knowing what it isn't is really, really, really important, because people today go to the doctor and everybody gets a blood test. No one blinks, Carolyn, when you get a blood test. No, everybody out there, I'm sure, has had a blood test in the last 6 months. But when was the last time someone had a sleep test to go, what's happening at night? And sleep, I was just in America at a big conference. Carolyn, sleep's about 20 or 30 years old. They're just learning what's going on. So we don't know anything about what's happening at night unless you're going for a sleep test. And the sleep test will tell you things like what side you're sleeping on, how much oxygen you're getting, your pulse, it's your sleep waves, a lot of complicated things.
All right.
Did that make sense?
Yeah, absolutely. And you're a doctor of dentistry, you were saying.
I've got a dental degree. There's probably a handful of us in Australia that spend a lot of time in sleep with a dental degree. In America, we're in America once or twice a year. There's 1,000 of us because it's a team approach. Sleep is a team approach. It needs to be a team approach. It needs to be a collaboration of doctors, and that's why, I'm at Reliance in Gosford, and that's why you've got a collaboration of doctors that all have a skill set, because it's not one person that can fix it.
Yeah, all right. Thank you, Dr. Mark Levi there, talking about sleep. If you do have sleep issues, we do recommend you get your own consultation from your GP, but hopefully there are some tips there that will help you get a better night's sleep. It's 10 to 7, you're on 92.5 ABC Central Coast.
Drive with Richard Glover.
I've got a curry I make which involves a kilo of onions. Wow. It's a very easy recipe. You just put it all